Hey y'all, so let's talk about what's going on with my neck, shall we? Do I sound thrilled? Because I'm not. Alright, so this is the result of the MRI on my neck, which was over a week ago or something, last 2 weeks, something, I can't remember, recently. So anyway, I have significant disc bulge C4, C5. Okay. So I have a disc that's out of place. That's always fun. Your discs, for people who don't know, are basically in between your vertebrae, okay? And they're supposed to be in a certain spot, and I'm having issues with that. So it's a significant disc bulge in C4, C5, which is your cervical area, which is your neck, okay? Disc osteophyte complex, which is a degeneration of the disc, which are soft, spongy cushions between the vertebrae, okay? I have a formation of osteophytes, which are bony growths that develop along the edges of the vertebrae. DOC, which is disc osteophyte complex, is typically caused by trauma, injury, obesity, and rheumatoid arthritis. I also have what's called uncovertebral hypertrophy. These are joints located in between the vertebrae, so they basically allow you to bend and move in all types of directions, okay? They are formed by the superior, which is usually higher, inferior is usually lower. They're formed by the superior and inferior uncovertebral processes, which are small bony projections. And that's what the uncovertebral hypertrophy is. It affects the joints between the vertebrae. There's small bony projections. There's an unknown cause, but could be related to age-related degeneration, wear and tear, trauma, poor posture, certain medical conditions like rheumatoid arthritis. Let me see what else. I have moderate central stenosis. Stenosis is narrowing of the spinal canal. So I've got moderate central stenosis, which is narrowing of the spinal canal in the middle of the spine. This is caused, it's age-related, it's degenerative changes like osteoarthritis, which I do have arthritis in there, herniated disc, which I do have, bone spurs, which I do have, tumors, which I used to have, and one was removed from my spine, thankfully. I also have severe bilateral neuroforaminal stenosis, and that's a lot, right? So let's get down to it. Severe, obviously, that's self-explanatory. Bilateral means both sides. Neuroforaminal is the foramina near the vertebrae. Stenosis is narrowing, okay? So I have severe bilateral neuroforaminal stenosis, and it's where the openings called foramina in the spine, they're basically windows in a way in your spine. They have a natural opening. Okay, so your nerves can come out. Well, mine are narrowed on both sides, severely narrowed on both sides, which causes compression of the nerves. And I do have pain occasionally down my left arm. They don't want to do surgery on your neck unless you are so bad off you can't function. Why you would wait until it gets to that point, I don't know. But one of my friend's friend had neck surgery, and when he turns his head, he's lost the ability to turn his head independently. He has to actually turn his shoulders with his neck because he lost the ability to turn his neck independently. So that's what's going on with me and my neck. Nothing good news, nothing good news related. It is all not good. They want to schedule me for a injection. However, here's my problem with that. I've heard a lot of bad things about it. Not to say that would automatically happen to me, but it just... anytime they're messing with your neck, it could be really bad. So I think I'm going to renege on the injection because they called me to schedule it and I didn't call them back. I will call them back and tell them I've read a lot of bad things about it and I don't think it's a good idea for me. It's a good fit. So they don't want to do surgery, and the injection's not a great idea. For some people it works great, and for other people it was the worst thing they ever did, and I don't really want to take that kind of chance. So the only thing left to do is ice and heat, and I lay down a lot anyway because I have a lot of pain in my back. Resting gives me a lot of relief on my neck and my back, and invest in a bunch of pain patches. I think those are my only options, and also physical therapy to strengthen the muscles around all this business going on in there. But again, I can't do that for a long time. So, I mean, I could try. I don't know. I don't know. I could call them and ask them, should I try? Can we do any type of strengthening that's not going to put pressure on my foot? So I'll probably give them a call next week because I think physical therapy is going to be a better option as opposed to sticking needles in there and wiggling them around and doing whatever. I'm not really down for that. It just, I don't know. I mean, it's called an epidural steroid injection. And let me see. See if I can find anything on that, which I'm sure I can. Nope. Hey, okay. Let's see here. Hey, quit. Quit. Why are you being so stubborn? All right, let's try this. Come on. You are being a butt. I also have a soft collar. So when I have to have my head bent, oh God, this keeps being really forceful about this topic that I'm not asking you for. God, I hate that. All right, so epidural steroid injection is called an ESI. It's a procedure that involves injecting a mixture of corticosteroids and local anesthetic into the epidural space, the area between the spinal cord and the surrounding bones. This procedure is used to treat pain caused by inflammation of the nerve roots, such as sciatica or spinal stenosis. So the procedure is, for those of you considering it, I would strongly think about it before you just dive in. The patient lays on their stomach or side on an x-ray table. The doctor uses an x-ray machine to guide the needle into the epidural space. A mixture of corticosteroids and local anesthetic is injected. The needle is removed and a bandage is applied. It reduces inflammation of the nerve roots, provides temporary pain relief, and can improve range of motion and function. Risks infection, bleeding, nerve damage, and allergic reaction. Do you think I need nerve damage? I don't think I do. I got enough problems going on. Candidates for this procedure is patients with nerve root pain caused by inflammation, patients who have not responded to other treatments such as physical therapy or medication, patients who are in good overall health. ESI injections may be repeated up to 3 times with a few weeks between each injection. Some patients may need more frequent injections depending on their symptoms. ESI is not a cure for spinal stenosis or other underlying conditions. The effectiveness of ESI can vary depending on the individual patient. It is important to follow the doctor's instructions carefully after the ESI, such as avoiding strenuous activity or driving for a certain period of time. This information is for general knowledge and informational purposes only and does not constitute medical advice. It is essential to consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment. This is for informational purposes only. For medical advice or a diagnosis, consult a professional doctor. Okay, so anything that I tell you is not medical advice. It is strictly information, basic information. And anything that you need to know in pertaining to your own health, you will have to have, talk to your doctor, and your doctor will order whatever tests are necessary to find out what's going on with you. In my case, an MRI was provided, and that's that. So that's what's going on with me. You guys take care. Much love. And I'll see you on the flip side.